We're three medical doctors, Dr. Niamh Lynch, I'm Dr. Maire Treasa, and Dr. Doireann O'Leary. We're also friends. We have a very active group chat and we'd like to share some of those thoughts with you. This is No Scrubs. Doireann, Céad Míle Fáilte, welcome into a new project taken out of the group chat and onto the podsphere. My name is Maire Treasa. I'm joined here by Doireann O'Leary and Niamh Lynch. You may know us from Instagram and various social media podcasts. We're all doctors in our own way. Two of the doctors here are much more qualified and specialised than me. I'm kind of the interloper in the group. But we've known each other a long time. We have our own WhatsApp group, and we've found there's often a lot of crossover, despite our very, very massive differences in what we specialise in and what we know about. There's a big crossover between questions get thrown into our DMs, discussion points now come up on social media. So we said, why not have a podcast to discuss this, kind of take some of the group chat out of the group chat and into the podcast world. So we've decided to call this No Scrubs. So as I said, I'm joined by Dr. Doireann O'Leary, GP, and Dr. Niamh Lynch, who is a consultant paediatrician. And let's just jump straight into it, ladies, because I think, and we can all probably agree on this, one of the most common subjects that comes our way via DMs whenever we put up reels or talk about it is aesthetics, the world of aesthetics and skincare. So we said, why not start there? Because while it can be a bit of crack, it's also serious medical stuff at times as well. So yeah, I'm opening the floor to you. Give me your thoughts, ladies.
First, EMT, it's really nice that we have like a professional broadcaster in the group to do that lovely polished intro. But you forgot to say yourself, you are in aesthetics. So you're, for context in this conversation, I suppose Niamh and I are like can discuss like the things that we have picked up and that we know, but you're actually like you are the aesthetics doctor, you do aesthetics full time. So you're the one who really
Yes,
knows what you're talking about here.
I do aesthetics full time, but I mean, I'm very new to the game compared to lots of other people in this world, but I've been very lucky that I've learned a lot from people. And I suppose, like you guys yourselves, and people might not realize this about medicine, really. You know, you do keep learning. You get your degree and you get your qualification, but you do, like, legally, we need to keep doing, the continued professional development. We have no choice. So, yeah, we're always learning and from each other as well. So, for me, yeah, definitely, I suppose for once, this might be the only podcast, however many podcasts we do, that I might know something about something in medicine more than you guys do. So I'm kind of going to enjoy this one.
MG, you have so much imposter syndrome. I'm always saying it to you. Yeah. Own it. Yeah.
I'll start because I'm the oldest and I needed the most aesthetic.
No, I'm Brady 79. It's just all the work I've done.
Well, my aesthetic, all I've ever really had done was Botox. A small bit of filler to undo the harm of the Botox, and more Botox and a bit of polynucleotides. So I started with Botox into my masters because I was grinding my teeth so badly, and my teeth were literally breaking in my mouth, so I had to do something. So I got mesenteric Botox. But you know yourselves, when you get to a certain age and the elasticity of your skin decreases. So this was, I'd say, around 3 years ago. So I was like really into perimenopause. So the scaffolding of my face kind of collapsed, and I became very, very, like, it all kind of came down, like, forward, and I became very jowly, I felt. And so I kind of thought, God, like, what am I going to do now? So I went to an aesthetic practitioner who's a dentist. So she understood the sort of facial anatomy very well. So she gave me just a little bit of filler along my cheek, my chin, my jawline, my neckline. And then didn't do anything more, just left the massages kind of grow back. So basically for vanity went back to cracking my teeth at night time. And then at the same time then I was getting a lot of pressure headaches at the front, and she said, "Do you want to try a bit of Botox on your forehead?" And I was like, you know what, why not? Like, I mean, what's the worst that can happen? So it did help with my migraines, and obviously gave me a lovely smooth forehead as well. And that was the main thing until my neck started to bother me. And I'll talk to you about my neck in a second. But I was thinking about it, MT, because I knew we were going to be talking about aesthetics today. And, we always talk about the benefits of aesthetics, and, how good it can make people feel. But I was talking to a surgical colleague the other day, and when she was a plastics registrar, one night she was on call, a lady came in with her lip had become black and had become necrotic, and she ultimately ended up losing the lip. because she'd had some filler put in by a practitioner. So even though you can get a like instant gratification from filler, it can be dangerous. And then I suppose we shouldn't talk about things really without talking about the potential side effects as well. So what are your
Yeah.
And I,
It's interesting
for
actually. Yeah,
MT,
no, go on.
for MT gives the kind of the full picture here. Can I just ask a question about the clinical vignette, Niamh? Um, do we know the background of the person? Now, listen, right? The best person in the world who's delivering aesthetics can have a complication. But I think it's important as well, just with this education piece about like, where you get your fillers and Botox and things. So that person, that patient in that scenario, do we know who did the Botox and fillers? Or
I don't know the backstory. She was just telling me, the way we kind of swap stories in the res kind of thing.
yeah. Okay.
So she was just telling me the story. I think we were basically talking about our own Botox and things like that, and both kind of expressing concern about fillers. But I mean, like Botox isn't without side effects either. So I think it's fair that we should cover those.
Yeah, and it's funny, my consultations here now, I'm actually standing in my new little clinic, and my consultations here, I deliberately made my appointments a lot longer than the previous places I worked in because there is a bit of, let's call a spade a spade, there is a bit of an industry now about Botox. The more patients you have in an hour, the more money you make, that kind of thing. And it's easier to do when you have a receptionist, when you have a clinic manager, when your one job is to stand in the room and to inject people, especially if you know these people, you know their history, this, that, and the other. However, I did realize a lot of the time my appointments were running over time. And then I kind of realized that I wasn't sure if we as doctors, and I only can speak about doctors, I suppose, because that's the area I know about. And I wasn't sure if all of us were always kind of getting informed consent of people. Do you know, like we'd send off emails, people say, read this and sign at the bottom. I don't know about you. It's a bit like the Apple terms and conditions. I would skim through these and I would just sign it off. So for example, we use the forehead as an example because it's an area people are familiar with. The forehead muscle, the frontalis muscle, is actually a pain in the posterior to treat. Everyone is different. Everyone's muscle moves differently. And the trouble is, if you get that Botox in anywhere wrong, you very much risk your eyebrow coming down over your eyelid. It's not medically dangerous, but it doesn't look nice. It's not an effect patients want. So sometimes you might find if people raise their eyebrows maybe 2 weeks after Botox, they might find they have like the little brow commas, I call them, or the little Wi-Fi symbols above the eyebrow. And that's left there, but that's because the practitioner who maybe did it 2 weeks ago didn't want to go too near the brow for fear it dropped your brow. And then they'd come back and they say, oh, people top it up all the time and haven't told me about this risk. But like whenever anybody's coming into my chair, if they happen to have that Wi-Fi brow, I'll just say very plainly, look, there's a much higher risk of me dropping your brow by injecting here. Yes, I have ways to modify against it. I'll inject more superficially. I'll be much more careful where I place it. I change the dilution, yada, yada, yada. But just letting you know as a patient, because this isn't essential medicine, it's just pretty medicine. So I think our risk threshold goes up and down depending on how badly you need a treatment. Like if you tell me I've roaring appendicitis and we need to get this appendix out of you or you're going to die of septicemia, I don't care what kind of scar you're going to leave on me. And if it's a Wi-Fi brow, I'm probably, for me personally, I'm happy to leave it because who goes around with their eyebrows up in the air all the time anyway? Whereas in general, the whole idea of Botox is to just reduce kind of the tension in your forehead and just make it a little bit smoother. It's not about line eradication and paralysis, which I think people think it is, and they say, oh, it didn't work. So it's about explaining that. And I don't think we did a very good job of educating patients about that and people. And I think potentially our practices sometimes didn't reflect that either. So that's just a very simple example. But the beauty of Botox is that you might not like the effect of it. And some people, it can be perfectly done job. And then they realize, you know what, I'm the kind of person I don't like the effect. I prefer my face moving, which is fine. In general, if you don't like the effect, if you don't like where it's placed, it disappears over the coming weeks. Filler, on the other hand, is a whole different ballgame. And the scary thing is that there's nothing stopping anybody going online and buying filler and injecting themselves, which is kind of terrifying. And people do it. And while the risk of complication is rare, it's there. And basically, when we're injecting filler, it's going in under the skin. We can't really see what we're doing, even with ultrasound. It doesn't remove all the risk. And if you inject filler into an artery, which is where the blood kind of comes to your skin and feeds your skin oxygen, keeps it alive, basically. If you block that off and if the release valve isn't released, that skin is going to get necrotic and die. So that's why that person lost their lip. And even more seriously, there have been documented cases of people going blind, for example. And people might say, how can I go blind if I had filler injected in my chin? Well, like, unfortunately, all our anatomy is connected and all comes back and it's all coming up to here at some point underneath the eye and it can cause issue. So I'm not sure that now. I suppose there is a balance to be made. I mean, Niamh, if I was to sit you in front of me that day, you got filler in your jaw, for example, from that lovely dentist, and I said, "Look, Niamh, there is a small risk if I inject this into you, your jaw could fall off, and your skin could die, or you might go blind." And I'm not sure you'd be as quick to get it done. So we have to temper how we explain it. But I think people need to realize the importance of going to a medical person to get this done, because the things when they do go wrong can really go wrong fast. And I suppose the beauty of going to a dentist or a doctor or a nurse is that, they will have, for example, the enzyme that dissolves the filler if there is a problem. So what happens is, say, for example, if that day you got that filler injected into your jaw and that dentist notices, oh, there's something not quite right here. And you will notice fairly quickly if there's something being occluded there. The skin goes very white and blanches very fast. The patient usually says, oh, Jesus, that's a lot of pain. And then you're like, oh, okay, if in doubt, get it out. You get your enzyme, you get your Hylays. I'm sure your hands are probably shaking and you're terrified, and you're mixing it up with the saline and you're getting the dose just right. And then you're injecting it into the patient and you're keeping them there for a few hours, sometimes a full day, and keep injecting to ensure that is being perfused. Because once that tissue is gone, it is gone. We cannot grow skin back. So these things happen, they're rare, but I suppose if I could hammer anything home is that it probably won't happen to you. It probably will never happen to a friend of yours. But when it does happen to somebody, you want somebody who knows what they're going to do. So I hope this hasn't scared everyone away. There's me going, I'm never getting filler ever again.
Well, I actually amn't, because I don't need it, because my masseters are back, and it's filler is just something that I'm just very wary of. I just think anything that has the potential to occlude an artery and cause necrosis, and it's there, you're taking it, really, it's not clinically indicated. Like for me, I kind of felt, okay, the mesoteric Botox was for dental reasons. The forehead Botox, yes, it was for cosmetic reasons, but it also massively helped my migraine. My first interactions with Botox were back in the 90s, when I was an pediatric neurology junior doctor. And that's the original use for Botox, was for children with lower limb spasticity, to inject it into the muscles to relax the muscles so we could get more function in the legs. So, it was only in the noughties that it became a cosmetic thing. And so I guess I'm just a lot more familiar with it. But I really feel filler, unless you have like a significant mental health issue caused by something that can be fixed with filler, then I think I'd just be very slow to go there again, ever.
How much filler have you got on your face, Doireann?
I don't have filler, and I've never done filler as well, just because of all of these concerns. Again, because, I know that it's a lot more complex than Botox. Now, I do get Botox. I've never gotten filler because of these concerns, and I suppose Niamh has that story that she had about the patient who lost her lip. And I suppose that woman probably, and we're assuming it's a woman, went on to probably have to have, extensive reconstructive plastic surgery, and all that goes with that, and how traumatizing that is. And as a case that stands out in my mind is when years ago, after my intern year, I first did a year of pathology, like as a pathology doctor. So you're looking at cells under the microscope, essentially, is where, like, say the skin cancer gets taken off. You're looking at it under the microscope. But we had a case meeting like every Friday morning, where everyone and from like pathology came, and like the surgeons came, the medics, the dermatologists. So it was a big meeting. And we had this case week after week after week after week of an MT. I've told you this one. Where we were looking under the microscope, this woman had extensive growths on her face. Now, I had never met her because I wasn't a doctor on the ward talking to her, but she was under ENT, the ear, nose, and throat doctors, and she had extensive granuloma formation. So every week they would send biopsies. Every week I'd look under the microscope and I'd present it back and say, this is granuloma. And it would grow and grow and grow. And they would tell us it was getting worse and worse and worse. And we had no idea what was causing this. Why was this woman having this growth on her face? Now, this was in 2011. And she did not disclose for weeks, because in 2011, filler was not common at all. But eventually, anyway, one week, the ear, nose, and throat doctors came back to that meeting on Friday and said, guys, she's actually told us that she had filler injected into her face. And now this is like a granulomatous reaction that she's having. So that one, I've never met that woman and I didn't see what was going on, but it stood out in my mind because this case went on for weeks and weeks and weeks and weeks. So now filler is a lot more sophisticated since then as well. And like I see filler on people all the time and I see that it looks so good. And there's people who filler and you don't even realize it because it's done so well. But that case has always stood out to me as one where I would worry about the granuloma piece. That's what
Oh,
would worry me because I just years ago as well, I had sarcoidosis, which is a condition where you might get kind of granuloma formation. So I've always stayed away from filler for that reason. Now, I'm not saying it's dangerous for everyone. It spooks me a little bit because of that. I think, like Niamh said, you're used to Botox from seeing it being used like on the wards. Like we see it all the time in medicine, like it's used for OAB, the gynecologist used Botox. And it's used for blepharospasm, for eye spasm by the ophthalmologist. And it's like it's a keener drug. If there is a side effect, like a dropped brow or like a sunken eyelid or something, like that'll go away in about 3 to 6 months anyway. And so I get Botox, but I've never any trouble with it. But I haven't gotten filler for that reason.
You had done there.
like
I'll try Prof Hido once or twice, and it's nice. But I just think it's too expensive to continue with it long term. And I did the vampire facial, but I just like, as I've told you before, I came home like washing blood out of my face. So the results were nice. There's no doubt about that. The vampire facial results were good, but I'm not going to do it again because it was too gruesome.
Too
It-
gory, isn't it? Like
Yeah.
they're taking out your blood, they're spinning it down, they're extracting the plasma, then they're injecting that into your face, right?
Yeah. And I was just lying there being like, what am I doing with my life? My face is grand. Like,
did it hurt?
yeah, it was sore.
Very like how sore.
Is it like a load of tiny injections all over your face?
Yeah.
And like,
No,
what's
that-
the result?
So the plasma, like the there's plasma, that those growth factors are all going back into your face. So you're getting all of that rejuvenation of like your skin essentially. And like I have to say, for about 3 to 6 months afterwards, definitely the skin was very, very, very glowy. And but I'm just not gonna do that again. And actually, Niamh, you were quite rightly pointed out when I discussed this vampire facial with you before, the blood like on my face and like on my hair and everything, that was actually just from the puncture wounds on my face. It was just like, you know, it,
Did you like drive home with blood? Like,
I did. Now I had a hat, but like
Did you have your big famous sunglasses on as well? Did you?
I do, so God would actually not have to retire those. So like results, yes, great. But am I gonna do it? No. It's weird because like me, if you know the way you said you had done filler before, but you're not gonna do it again. I find as time goes on, I'm kind of just like gonna like I'll always do Botox because it's so effective and it's very handy. Very quick appointment as well. It's not painful. But as time goes on, I'm kind of like less inclined to do these things, I suppose, like the dramatic
but
vampire.
you see, like you're both like 10 years younger than me at least, right? And ye haven't hit perimenopause yet, okay?
That's what I was going to say. Yeah, your perspective changes as your
Yeah.
face changes.
Yeah, like I did nothing cosmetic ever until I hit perimenopause. And there's a great book by a woman called Nora Ephron. Actually, she'd probably be dismayed at the fact that so many women are turning to cosmetics now, because it's called I Feel Bad About My Neck, and it's basically a feminist sort of battle cry, as in, you shouldn't feel bad about your neck and it's grand, right? But I did feel bad about my neck, and that's when I got the Nefertiti Botox in my neck. And I tried Profilo again, same as you, Doireann. Very painful, very expensive, and didn't really last. And then I got the polynucleotides, which is the fish sperm, which is you can't get it obviously if you're allergic to fish, but or a vegetarian. But
It's amazing how they leave their ethos behind sometimes. But anyway, go on.
but I think all I'm doing is maintaining and holding back the tide. Because, you know, I have to be realistic. Like, I'm 51. I'm not trying to look 25. Do you know what I mean? I just want to be.
That's, but that's the key. And I'm eager to let you come in here. But what I know it, right? I haven't gone through many perimenopause yet. Um, But like there are those like cliffs where you go through a dramatic aging spell. And I had one of those around 31. I changed a lot, a lot, a lot. And that's the time that I was doing the prop hilo, doing the PRP, doing all that stuff. Because seeing those changes, you're a bit like, oh God. But as time goes on, I'm more like, I just want to look like the best version of my current self. I really don't want to look 25. I really don't want to look different. You're better off to look old than to look weird. And if I look like, you know, the a decent enough version of myself, I'm happy enough with that, you know, like not like nobody should be trying to look different, I think, or trying to look or even trying to look younger. I think we just need to be trying to look like the best version of ourselves. That sounds very pontificating. Everybody's free to do whatever they want to do, but that's the mindset I've tried to get it to.
Yeah, I mean, like, you see, there's no other medical specialty. Like, Niamh, can you imagine? Like, I know you work in pediatrics, so under 18s wouldn't be coming in without their parents anyway. But can you imagine as a pediatrician, some child comes into you and says, "Look, I have a pain in my knee. I want you to do something with my knee now." And he doesn't want you to assess him. He doesn't want you to say, "Look, maybe that pain's coming from your hip." He doesn't want you to say, "I don't think this medication's for you. They're fixated on this medication because their mate over the road had it done and now their knee looks great." Same in GP land. You know, I know you probably get a version of that sometimes there in GP world. People say, "My friend's on this tablet, they don't have high blood pressure anymore. I wanted to." I know that can sometimes happen. But in aesthetics in particular, people see things on social media and they say, "I want this," or "I don't want this because she got it and she looks terrible." And no more than the filler, like it all depends on the hand who is injecting it and who's placing it in the right plane in the right place. And that comes with time and experience and all that kind of stuff, and choosing the right filler for the right part of the face, for an example. And I think for a woman over the age of 40, we'll say filler is a great tool to help replace what we've lost. Because what happens is as we get older, we lose bone density. That's why Doireann's always mad into getting people on the vitamin D and the walks and the weight bearing exercise. Do you know, but this is part of it. Like the very serious part is you could fall over and break a hip when you're older and you die. But this more superficial part is that the bones in our face actually get smaller. So therefore it stands to reason. Combine that with loss of collagen elasticity that our face starts falling down and in. And that's where the filler is lovely to put, you know, a millimeter back in the jaw, for example, as an example, or potentially your lips that were beautiful and bountiful at 25 are now ruined because you're 50 and you went through menopause and life and children and smoking 60 a day and living, you know, and then you're just replenishing that. But I think you're spot on there. And that's the approach I try to take with patients all the time. Like trying to educate that if you're a woman who's 60 and you're just getting Botox in the forehead and in between the eyebrows and around the eyes, but your skin is looking its age. Like you are going to look a bit weird. You're not going to look as youthful or as sprightly as you think you are. So I think rather than there are lots of people who don't want injectables, and that's fine. And as I'm always telling people, if you have to choose between injectable or decent skincare, choose the decent skincare always, because nobody ever looked old because of a line or a wrinkle. We look old because our skin looks dry, dehydrated, lost its bounce back ability, lost its collagen. We've lost, I suppose, the polished look that a joyful life gives us. Do you know what I mean? For various reasons. And like if you don't have the budget for the more expensive stuff, and this stuff is pricey, you know, there's no two ways about it. And you know, instead, why not invest in a retinoid? Why not invest in a decent SPF? Like if everybody listening to this today just went out and bought a decent SPF 50 and wore it every day, they certainly will not be giving the likes of me more money in 5, 10, 15, 20 years time. You know, so protect what you have, you know, enhance what you like about yourself. You know, a good haircut brings people a long, long way. And then, you know, if you're still not happy with it and you want to look a certain way, or you want to look a fresher version of you, have no shame either if you are going to go for something a bit more intensive. Because what's the slope, for argument's sake? Skincare over the counter from your local chemist, skincare from fancy pants skin shops, medical grade skincare. Then you're going to prescription skincare. You might need it for anti-aging reasons, like for example, like say tretinoin, or you might be going because you've got acne, rosacea, pigmentation. These are actual issues. Your skin is an organ, so treat it as well as you would if your liver was sick. Then you might decide, actually, I want to help, you know, fix up the collagen here. Are you going for supplementation? Are you going for collagen supplements? Have you decided then, are you going to go for microneedling? That's a small step up the ladder. Do you want to just stay completely natural, as some people do? Then microneedling is a great choice. You're just using your own kind of, your own kind of recovering methods to help yourself grow and get a little bit more glowy. TLP, if you're happy to drive around Cork, Galway, Dublin looking like a vampire's bitten off your face and you have a hat on, a la Doireann, great for glow, she said it herself. Or do you want to go up a level again? Do you want to go using prescription medications like botulinum toxin? Do you want to use Profilo? Do you want to use polynucleotides? Do you potentially want to throw the kitchen sink at it and go for surgery? All of these options are okay, so long as you're okay with it and you're doing it for the right reasons. You're getting your money's worth and you're getting medical support to help you through this physically and psychologically. And also, if things go wrong, that somebody's going to help you through it as well. It's as simple as that. People don't need to make it a thing. You see these people having these big existential crybeans about, I hate my neck. If you hate your neck, do something about it. And that's it. Don't make a thing of it.
Or don't, but come to
Or
terms,
don't.
you know. Like I think that's I suppose the other thing is, like, it's undeniable that there is pressure on women especially, but increasingly men. And I'd be interested in your thoughts on the whole brotox kind of side of things. But there is this sort of relentless pressure coming at us from screens all the time, and this sort of unrealistic standard. And we've talked about this before, the sort of Zoom dysmorphia, where you're looking at yourself on a screen, looking back at you, and you're seeing, as is human nature, you're seeing all the bad things about yourself. And that's not what people see when they see you for the first time. They're not looking for the flaws. They're looking for, is this a human being that I can connect with?
Actually, literally not what they're seeing is all, because the way the camera reflects back at you, like distorts your image. So it's literally not what anybody is seeing of you. But I think, to your point as well about, like, if you do want to go and get something done, that's okay as well. And to own it. And because, say that woman who was not disclosing that she had gotten filler, and she wasn't telling us, she was in hospital for weeks, maybe because of maybe shame or remorse, and that she was thinking, oh my gosh, I did this and now I'm in hospital. But, like, that's a dramatic example. But it's okay as well to want to explore it and go to an appointment and maybe ask, like, what is the best thing for me? Because I think a lot of people think, like, oh, it's Botox and filler. Those are my options. But it's so much more sophisticated than that now. Like, there's a lot you can do before you go to those, like you were saying, MT, like the like microneedling is a lovely one. Um so yeah, anyone listening, if they do want to explore it, like, there is a lot you could potentially do before going into Botox and filler.
Absolutely. And again, and if you don't want it, that's fine too. But I would implore you, as the person who doesn't want it, and you do you, but don't be talking down on people who do get it. Like, it's not fair. You don't know what anyone's backstory is either, and you don't know why something is being done. And you know what? Like, it's all kind of, I think, growth and movement. Like, when you think about it, like 50, 60 years ago, people would have been frowned upon for dyeing their hair. We used to laugh about Americans and their bright, shiny white teeth. We were happy. It was nearly like, you were, I don't know, you were being very, very vain if you went and got braces up to like maybe 25 years ago. And now, like, you wouldn't leave a teenager with crooked teeth. Like, you just wouldn't. Whereas it was done back in the day, getting your nails done, getting your hair did, these things, our outlooks and things change. And you know what? There is no harm in a bit of vanity either. Like, so long as my vanity isn't harming anyone else and isn't putting me into debt or anything, there's no harm in it.
I don't think it's all vanity though, isn't it? It's not all, there's a lot, like, there's a
Fair
very
identity for some people.
logical thing about, like, looking in the mirror or looking at yourself and what you see. And, I mean, I really don't know anything. I have not read anything about this, but, like, the psychological impact of bodily changes. Like, I can just think of a very crude example, but, um, you know, after surgery and you have a new scar, like, there's a bit of psychological impact on that. You're not just like, oh, sure, gosh, that's total vanity. It doesn't matter whether I have a scar or not. Yeah, then you're like, gosh, that's strange. That's a difference in me. I said and that's a really crude, bad example, but, like, it's not all vanity. And as well, I think is like MT. I think you discussed as well. Like, we were chatting about one time, like, when people are going through a really hard time in life, like, that is a time that people kind of can go to Botox and filler to try to, like, feel like, if I can, like, I don't know what it is. I'm not speaking from an educated standpoint on this at all, but, is it that if they think that they can control something, or if they look better, at least I might feel better. There is something to that.
Absolutely. I many's a time since I started doing this kind of work, Once you get people up on a chair, they start telling you things, they start, yeah, they might say, I know my skin's in terrible condition. I'm like, would you stop? Your skin is fine. If you want help with it, we can discuss it. But like, I'm not here to pick out your flaws. And then they say, well, and then they will inevitably, they will kind of segue into, yeah, I'm going through a divorce, or, my child is stressing me out, or I've lost my job, or I'm just not feeling like me anymore. And these identity crises tend to happen around when you've had children, when maybe a relationship breaks up, maybe when you're going into menopause, just because they are big shifts in life. And I think our hormones play a part in it as well. If you're tired, you don't look your best. That's just the way it is, for example. And that can be prolonged. And sometimes people might just decide, I want to go for a little pet me up. And they've decided, for example, that Botox might be the answer. So my answer is that at all times. If it's something like Botox, it's not going to change their appearance, just going to make them a fresher version of themselves, or like maybe Profilo, which definitely would give them a beautiful glow. Sure. I'm not going to pathologize that. If somebody came into me and said, I want my face to look like this, and I want to color my hair red when they're a blonde in front of me, and I want to do kind of a sandy and grease makeover, within the next hour, I'm like, okay, you definitely are not the kind of person I want to be injecting right now. Let's do something small and put them on their merry way and tell them to come back in a few months' time. So you kind of have to be able to read people's motivations. It's very rare that I'd have to tell somebody. It's happened twice actually that I've told somebody I'm not I just don't feel like I want to treat you today, and they're not always happy about it at that time. And but like at the end of the day, like it's my medical license on the line, and they'll find somebody else if they really want it. But one of them actually rang me 4 months later and said, you were right. So I mean, I'm not looking for a pat in the back there, but sometimes if people are looking for something very, very drastic and they've never done anything like that before, I wouldn't say it's always a red flag, but it's definitely an amber flag to discuss it a bit further.
Yeah.
Yeah, the ethics around it are huge. Like, in terms of, i- say, for example, we all know the Love Island look. I mean, they all look very, very similar. And these are young women in their absolute prime, and you do have to question the sort of pressures that they're coming under, that they're putting themselves under, but also, why people are kind of obviously everybody has free choice and you can alter your appearance by doing whatever you want, but you'd have to, you'd have to wonder if there are other issues at play in the background, other sort of mental health issues, and worries that these people have that they're just trying to mask with their facial appearance.
Like it's a self-esteem thing. Like, I think if you've low self-esteem for whatever's going on in your life, you can start even if it's not a cosmetic self-esteem issue. Like, I can think of times of extreme stress in my life, and that stress kind of can actually can have an impact on your self-esteem. And then that kind of like try and then that can kind of make you feel bad about how you look. So if you're feeling bad about yourself for another reason, you might start trying to think, well, if I look like those girls in Love Island, then I also feel good, and I also like have happy, amazing, perfect life like them as well. I think I actually need to do some reading on this because I think it must be fascinating.
I think as well, like what I find very interesting is I've had a couple of young girls ask me what they can do about their cankles.
Oh, that's
You
so sad.
know,
Niamh, as a mother of girls, this whole thing must just be
yeah,
quite
it's very intense. Like, they're the younger one isn't interested in going to discos. I
ready.
think because but she doesn't want to wear the short dresses. She's just not, she's just
Oh,
thinks it's silly.
extreme. Can she come over and talk to my children about never wanting to leave the house? Full stop.
Yeah, that's it. I know. But the older one has gone to a couple. Didn't really like them because she felt that they were kind of too loud, and it was mostly just other girls at the disco. The boys tend to not go to the discos. But this thing about that they're being constantly fed on social media, the flaws that they may have, and so a couple of girls have asked me over the years what can they do about their cankles, and
Or Niamh, as patients.
as patients, yeah.
What can you say?
So, and can I refer them to somebody as they don't like the fact that their ankles are fat, and is it a medical problem? Is there something wrong with them? And no, it's just the shape of their legs, and there isn't really a quick fix for it anyway. But there are fixes for it. They're very expensive and they're painful. but they will have seen these on social media and think maybe it's an option for them, you know, and it's very sad. And you know, you just see them at a certain age, you just see something click in them, and you know, they become more self-conscious. But where I used to notice that exclusively in girls, I am now noticing it in boys as well. And I have had male patients who have dropped out of sports that they love, like GA and rugby, because the tops are too tight. And they would have, a lot of boys will have a little bit of breast tissue. It's normal. It's normal at the start of puberty. They're getting teased by their peers then, and they don't want these skin tight tops. They don't want to get teased, so they just drop out of the sport entirely. It's very sad.
Oh God. I'm like, you know, that's
Interesting. Yeah.
something that I would like. I'm standing here in an aesthetics medical clinic, you know, having this discussion with you guys, and I have a little girl at home, and you know, I have had the discussions at home, thinking like, what would you do if she turned around and asked you, inject her lips? And I was like, no, she's perfect, perfectly perfect the way she is. But like, those years aren't too far off where, you know, she's going to be conditioned to be told she's nowhere near as good as she is, and she's nowhere near as beautiful as she is, and she's not perfect the way she is. You know, she'll start getting that message. Like by the age of 4, I think there's a survey done, I think in Harvard a few years ago, that little girls thought they weren't as smart as boys, or they weren't able to do certain jobs in the way boys could, like be a pilot or be in the army. So it stands to reason they're going to get the same messaging as well about being beautiful and pretty. And sometimes like I'll put a lovely little pink coat on her and I'll say, oh, you're gorgeous, do a twirl, and she'll do a twirl for her daddy and stuff. And I tell myself, God, if she was a boy, would I be doing the same? And I think I would. If he was in cute dungarees, oh God, you're so cute, gives a twirl. But you are wondering, are we feeding into this? And then boys are getting this messaging more. And you have to blame social media, because back in our day it was just magazines. They weren't marketed towards the boyos. The boyos got shoot and score and match of the day. We got smash hits, and then we progressed on to like the Sugar magazine and Ms. and Cosmopolitan, where they were telling us from day one, this is what's wrong with you and this is what you have to pay to fix it. The lads weren't getting that. At most, they were buying magazines to do up cars, and now with social media, they're being told how to fix things as well. And then maybe people like me are partly to blame as well. Like I would be constantly telling people in the clinic, for example, I can do hair consultations to help, balding and, men who are losing their hair. And I can do treatments for that, and I can give prescriptions. And then you're thinking, is this medical? Is this cosmetic? It's between the two. Again, if you're bald and you're happy, rock on. If you're bald and unhappy, do something about it. But you're over 18 and you can make that choice. But like, does that messaging filter down? And then like Niamh said, the tight tops. I mean, wouldn't it just be simpler to make the tops a little bit looser for everyone? Girls dropping out at Gaelic games so often because they're forced to wear the boys' jerseys, and like they don't fit girl shapes, and it's not comfortable. And the dressing rooms are built in 1962 and they're vile. They haven't got toilet paper. They certainly haven't got any sanitary ware in them. So anytime we're trying to tell girls you can do what you want, we're kind of putting these obstacles in front of them. And then with the boys, all of a sudden we've made them much more, suppose, self-conscious of what they look like because of social media, because they're seeing the Love Islanders, they're seeing the boys who look, like they have about 2% body fat, and it's all nicely oiled and sculpted and waxed. And I mean, jeepers, the chiseling
Oh,
on
do
that.
you know what? Actually, speaking of waxing, I know this is kind of this is a bit of a tangent now, right? But one of my very good friends is a GP, and she works a lot with students, and she said that pubic lice have gone extinct in Ireland
Oh, you see,
because they've moved there.
the benefits of everything.
Interesting. Interesting.
The
Salmon.
has been destroyed.
Can we just shave all children so that we don't have headlights?
Yeah. Get rid of headlights.
I just thought that was hilarious, like, I couldn't believe it, like, I mean, I saw a clip online one time, and there was a girl, she was talking to the camera, and she said the only place that a girl should have any hair is on her head, on her
Somebody at the
eyebrows.
door here. Give me, you guys talk on fire there 1 second.
Right. What age was the person saying this, Niamh?
She was in her 20s, and she was doing a piece to camera, and she was like, the guys, the only place anyone should have hair is on their head and on their eyebrows, and like no hair anywhere else, so God forbid, like, if you had a bit of a tash or the odd hair coming out of your chin, but like that meant no armpit hair, no hair on your arm, no hair anywhere on your legs, no hair anywhere except your head or your eyebrows.
Mm,
And like that's the standard now, apparently, for the young people,
yeah.
men and women.
The current trend. I suppose like that's and somebody, telling people like that they should have these insecurities like that, you know, obviously you know, it's appalling, that's wrong. But I suppose as well, like, you know, aesthetics, like I have huge respect for like the aesthetic space and everybody working in aesthetic. And I actually think it's a really nice industry, actually, just, you know what I mean? So I think that we've set a lot of the cautions, but it's actually like, and particularly for you, MT, I know like your ethos is very much about like it's holistic. It's the, you know, taking care of your skin. Like you've drilled that into me for years, you know? And you know, just taking care of like yourself overall and your stress and like, you know, your like nutrition and movement. Like you're into all of that. So I think aesthetics is a nice space and a huge respect for all of our aesthetics colleagues. And it's not something to actually be frightened of. It's something that can be beneficial if you're going and you go to somebody very genuine and just find the right person. I think finding the right person, that can be hard. And I think a great way to know somebody's good or not, and they say this about a surgeon, the best surgeon knows when not to operate. So also, you know, you're in the hands of somebody really good actually if they send you away. And I've I asked for lip fillers actually before my wedding, and the surgeon that I went to, he said no. And he just said he didn't want to do
But
it.
no,
Yeah.
did you wait till the week before or something?
No, I was organized. Uh, but he looked at them for ages. He looked because he was this, oh gosh, he doesn't work anymore, but you think he was a retired plastic surgeon. And he used to do this clinic now kind of in his retirement. I'd say he was in his 70s. And he examined my lips. Like, you know, if you think of like the oldest school surgeon you can think of, and he examined my face for about like, it must have been about a good 5 minutes, like looking at it from all angles. And he's like, no, I don't want to do it. Um, but that was a good example of somebody saying no, like a surgeon saying no. And then you've sent people away as well. Um, and, you know, so MT, right, putting this one to you. How do you find the right person in aesthetics? How do you find the best person for you?
It's really hard because there is no register, and this is part of the problem now. I know people are making moves. For example, there's an Irish college now kind of set up to try and for aesthetic doctors, as an example. I know the aesthetic nurses also have their own grouping. And kind of if you know somebody is affiliated with them, that's potentially a way to potentially, but I mean, you're feeling your way in the dark. So people often find you via social media. Word of mouth is probably the safest. But the trouble with word of mouth is you're relying on when you go for tea with Niamh Lynch, that Niamh Lynch will disclose that she got something done and then she'll tell you what happened and whether she liked it and whether she didn't. So like I had a hilarious situation here actually. My first week where I opened up, I had one appointment at 6 o'clock and then another appointment at 6:30. And as one of the ladies was walking out, a lady was walking in. They're like, "What are you doing here?" There were two sisters. Ash. But in general, so they now know, so they talk to each other. But like, you know, and this is a small town as well, so I would meet lots of people, and you know, sometimes you do find them wondering, God, is she going to mention or is she going to tell himself that she had that I was in? But you don't, because you're still a doctor. It'd be the same as somebody came in for, you know, they were worried that they had, you know, genital lice or hair lice down there, you know, kind of thing. So we treat the same thing up here, but word of mouth is your safest thing, but it takes a long time. People use social media, but I think what is a good rule of thumb is to look at what that person looks like. First of all, look at their own qualifications. I mean, I have it written on the door here what my qualifications are, and I'm continually adding to them and I'm continually adding to my expertise. So, you know what? A beautician who tells you that she can inject just because she can and just because she's gone to England to do a course does not mean she's qualified to do it. And so, straight away, discount them, go to somebody medical. That cuts out a lot of the risk from the up. Then have a look at that medical person's face and decide, is that a look I want to go for? Do they look natural? Do they look enhanced? Like, as I say to you guys before, like my look is more Rose of Tralee rather than Miss Ireland. So I think I attract people who might, not that I say who want to look like me, but people who want to have this kind of aesthetic, which is, you know, decent skincare, you know, very, very subtle. Like I've bit of Botox done, I've done Profilo, I have polynucleotides done once because I am like the cobbler with bad shoes. I never have time for my own treatments because I'm doing other people and they're expensive as well. Like I had a friend, she's a nurse down in Gart in Galway, how Yvonne, she did one session. She's like, no, you need to have two more. And I was like, I know Yvonne's not going to do it, are you? I'm like, no, Yvonne, I want time. But my point with that is go to somebody who you like the look of. And sometimes what social media can be misleading. I think it can be helpful too. If people are putting up videos about their content, you get a vibe over what they're about. You get a vibe over what's important. You get a vibe over their red letters. You get a vibe of what they're happy to do, what they're not to do. And I won't be for everyone. I'm sure there's been people who come in here say, she's weird. I'm not going back to her, or I didn't like the cut of her jib. And that's fine. There's horses for courses, and there's plenty of us out there. But word of mouth, check if they're medically registered and go from there.
Yeah, I would definitely avoid the sort of the non-medical person, like, a dentist, a doctor, or a nurse who has a doctor to prescribe the Botox is what you're looking for. There's just so much rogue kind of practitioners out there, and most likely they're the ones that are having the complications that need to go to the emergency department, because your doctor, dentist, nurse will know to look for signs of, say, complications of fillers as they're injecting and immediately reverse them. Whereas somebody who doesn't know what necrotic skin looks like, or pre-necrotic skin, they mightn't actually necessarily pick up on the red flags, and they may not have access to that enzyme. I think there's also a risk of an anaphylaxis to the enzyme, isn't there? So you have to have
If you're allergic to these things, yeah, it can be
you
a
have to have
problem.
adrenaline on site as well. So, like,
CPR.
yeah, somebody who isn't medically qualified could end up, not being able to reverse the filler, number one, reverse it and cause anaphylaxis, number two, and not be able to deal with the anaphylaxis. So, like, for a basic safety level, you're going to want a medically qualified practitioner to be injecting your face.
Yeah.
So that's basically medical doctor, like went to medical school.
Did all that torture. You've no
Yeah.
idea. Fundamentals
Dentist
of
as well.
biochemistry. Had to sit there for 12 weeks so I can inject Botox into somebody's face today.
Protect a human body for 2 years. And dentists, like I think dentists aren't, I think whenever doctors are talking about this, we don't talk about dentists enough. Like dentists are great. It's a dentist who does my Botox.
Dentists
Very
are
good. I just start writing your blood letters now to the dentists.
Yeah, most of the early aesthetic practitioners were dentists, and they were kind of the ones who led the way, really. So yes, doctor, dentist, and a nurse, but a nurse has to be working with a doctor, don't they?
Yes, they have to be. The rules are there's nothing stopping a nurse injecting Botox, but the issue isn't even the right word, but the caveat is no more than in a hospital. They have to have a doctor who's going to prescribe that for them and who would have assessed the patient. So it's a bit of a red flag too, because it's not good enough that a nurse would kind of have me, like, say, prescribing for her in Dublin, and that I write a prescription and that she injects a patient. I need to see that patient as well, and I need to see the patient face to face. Somebody needs to implement the plan and then go from there. That's not to say they're not competent injectors, but that's just the rule. It's just the way regulation works in this country at the moment. And dentists, like you said, doctors. Interestingly, I think the first ever Botox, the first ever person who actually noticed, oh, this is actually, good for skin, was an eye surgeon in Canada.
In Vancouver, I worked in that hospital.
Did you, Gina Brothers?
Yeah. So it was soon. I was in Vancouver in 2005, and that wasn't long after Botox had been adopted as a cosmetic treatment. So that's 20 years ago now, is it? Yeah.
And that's still such a new field. I mean, you think about it, there are people today who say, I wouldn't be doing this treatment, wouldn't be doing that treatment. They're all so new. And I suppose in the realm compared to traditional medicine, yes, they are. But then you have to remember Botox has been around since the 60s or 70s, treating various spasticities, as Niamh said, and twitches and pains and twinges. It has a huge medicinal uses, so we know it's safe. And I suppose absence of evidence for the newer regenerative treatments doesn't mean that it's not working. It just might mean we not have 20 years of a randomized control trial. So this is a very new field. So it's actually really exciting. And some doctors have said to me, are you not bored injecting Botox into people's faces all day? And my answer to that is no, I love it. I would be bored standing in your operating theatre, fixing knees all day, or I'd be really effing bored doing pathology, for example. It wasn't done for me. So
Productive though, that's not what you do. You
no,
don't
exactly.
inject Botox all day. You do so much more than that. Aesthetics is more than Botox. Production.
Every specialty is more than what the people who don't like it say it is. And that's the lesson in this too. There's a specialty in medicine for everyone. And you will come across from doctors and in all walks of life who are in jobs for various reasons. And they're not in there for the right reasons, or they were there because they liked it 20 years ago and didn't move on. And now they're cynical and they hate it and they hate everyone and themselves. And same is true in the world of Botox as well. I'm sure pediatrics GP, we all know the burnt out GP who we should have left it 30 years ago, but is there because they know nothing different. We know the burnt out surgeon who hates everyone around him, actually wondering they're going to throw a scalpel at me. The same is true in Botox. Like if you're somebody who's come into aesthetics because you're burnt out in other fields of medicine, but you're not there because you love it, you're not going to last long there either, because it is intensive. You are talking to people all day long, and they're paying a lot for the service. So you have to give them the service they're paying for, and that's not, that's full on my attention. And you're their doctor while they're sitting there, and that means you end up sometimes consulting over, telling them, giving them advice and other medical things as well, and that's fine. And but like if you don't like that, that's going to burn you out fast as well.
Yeah. I couldn't do I think it seems like a really exciting, very interesting job. I can't imagine somebody describing it as boring.
Oh, lots do. Sometimes I do wonder though if they're just saying that because they're saying that to me as they're jealous as they drive by to go and do a night shift and be in a hospital for like the next 36 hours.
So they have
Convince themselves that it's boring. I couldn't do that. I would be too bored. I
But
have to be in A&E in 4 in the morning.
exactly. This makes me feel alive. And maybe if it does, and sure, no more than getting Botox. If that's your thing, rock on and do it. And if it's not, don't be upsetting other people. But I think a good point to wrap this up is to hammer it home, I suppose, the importance of skincare and also the importance of a decent consultation. That's where Doireann, the GP, comes in, because I always say this, I take my hat off to every GP. You guys have 7 to 10 minutes with the patient. Anything could come in through that door and you have 10 minutes to deal with it. Whereas like when I do a skincare consult, people book in advance. Sometimes they tell me why they're coming in. Like, and I would think about things. I have half an hour. It's just me and them. And we're only talking about their skin. And yeah, we could be talking about medical things that could affect it, but it's just that and it's half an hour. And I barely get through it. You have like 7 minutes and you don't know what's going to come in. And you're doing that like what, 20 times a day when you're a GP. Like, I mean, hats off to you guys.
Laugh. But we were talking about this before, earlier today, MG, about like do avail of your GP if you are suffering from a skin condition. Like, it's a typical things, skin things that a doctor or that a GP can deal with. Acne, rosacea, pigmentation, eczema, right? Like if you have acne or if you have a teenager who has acne, like a great first port of call, I suppose in the first instance, you could try your pharmacist because there's a lot of over the counter things. But I do go to your GP. I think people don't actually think to go to their GP. And I'm doing a dermatology diploma at the moment. The consultant there she's a dermatologist and she often gets referred like these refractory eczema or acne cases, whether in adolescents. And she said they more often than not, they've spent thousands on treatments like that have not been delivered by a doctor or a nurse. They're going to kind of be salons or beauty therapists. And like I mean, salons are amazing, and the treatments that they deliver are excellent. And I love going for my beauty treatments as well. But acne is a medical condition, and go to your GP, talk to them about it. If GP can't solve it, refer to dermatology, or indeed skin consult with somebody like MT, who can do skin consultations. Um, I don't know why people don't kind of think to go to doctors or to a GP, whether it's for acne or rosacea or a skin condition or pigmentation. Is it because people will think that we think, oh, that's vain, that's a beauty condition? But actually, these are medical conditions, and I think it's important for people like to feel like to go. And I know access to GP can be hard. You might be waiting a few weeks, but look, I suppose in terms of acne, rosacea, pigmentation, the rest of it, it's okay to wait a week or two, typically.
Mm.
Um, so do make use of medics. We can treat these things, and there are great treatments out there. And like MTU do offer skin consultations.
Yeah, like I mean, if you have bad rosacea, no amount of pretty lotions and potions are going to fix that. Or acne. Yeah, and what kind of breaks my heart, to be honest, is when I see teenagers who've been left for too long without treatment. And I don't blame their parents. There's definitely, maybe this is us as medics, we haven't been good enough in getting this message out there. They've been untreated, or, they might have even gone as far as a doctor, and the doctor says, I want to refer to a dermatologist potentially for Roaccutane, and people are afraid of Roaccutane because it does have potentially very serious side effects. But so does having a face ravaged by acne does. And that scarring is there for life. And then it's an expensive business trying to rectify that in future with microneedling and lasers and really, really serious, powerful lasers as well. And the confidence hit that can also give somebody when potentially, had it been nipped in the bud very, very early on, you know, or if you potentially just needed a course of Roaccutane, so what? You know, get it from a professional. You know, like I won't prescribe Roaccutane, it is outside my scope, but I will refer people for it. And I will try other things first. There are other medications. We can use prescription retinoids like tretinoin. We can use oral antibiotics. We can use topical antibiotics. We give advice around your lifestyle, other medications you might be on. You know, sometimes other meds can trigger things, yada, yada, yada. And that's just acne as an example. And but don't leave it and don't be afraid to bring your child to it either, because you're much better off treating it, because acne doesn't go away.
And I from the pediatric end, it can really, really affect a child's mental health if they have acne. And you know, I suppose, look, when I was growing up in the 80s, there was kind of really nothing that could be done apart from maybe antibiotics and a sun lamp. That was the treatment. Whereas now, like, the treatment is so much more nuanced.
Red and blue light for acne.
Yeah.
To make the comeback.
Yeah, exactly. Maybe we were ahead of our time. I remember we had a sun lamp at home, and I had a few spots, and I decided I'd put the sun lamp on my face, and so I was inside in the room anyway, and the sun lamp was blasting into my face, and it exploded.
Oh, Jesus.
Like, so I'm lucky I didn't have like a load of glass on my face, like molten glass in my face too, but I managed to duck on time. But you know, we actually had a sun lamp in our house. You
For
know?
what? Was it
Stop
for
it,
seizure
right.
affective disorder or something? Or
Do you know, I have to ask my parents why we had a sun lamp. I think they bought it so they could have a tan.
And once was it like a seasonal affective disorder? One evening, like in the cold, dark winter, it was like cold at 4 p.m. Was your mother like, I need some light in here?
but you got out a catalogue like Oxendales because she didn't have
Yeah.
social media at the time.
No, I don't know why we had a sun lamp, but we had a sun lamp, and it nearly ended my life.
Jesus, Mary and Joseph, don't take sunbeds, don't lie on sunbeds, don't buy sunbeds, don't use sunbeds. Use LED light. It's great for collagen, elastin, and you can use blue light for acne. I like to mix it with red, and it gives a nice purpley glow. So you're getting the kind of the antibacterial effect of the blue, and then you're getting the red light as well for just basically lowering your inflammatory, I suppose, reactions in your skin. It's also just great for collagen and just glow. And you know, use that. That's a really good adjunct, but don't expect that alone to treat, you know, fairly robust acne. It's an addition. It's not you're going to need medical care if you have acne. And like Niamh said, especially with kids. Actually, I don't even mind kids. If I had a face full of acne right now as well, it would definitely knock my confidence for six. So I don't know why we're expecting 15-year-olds to just grow out of it. Same as rosacea. We have different periods in life where it can flare up. It's curse of the Celts. Don't be buying lotions and potions without getting advice from a doctor first. Like, for example, when I do skin consults, I know there are certain products that will complement the medications, the prescription medications that I prescribe as well. One works with the other. Pigmentation, really hard to get rid of, and certain lasers and things and IPL can sometimes exacerbate it if it's hormonal. So you need to go to people who know what they're doing. And there's great devices and help out there. And you know, sometimes skin isn't just vanity, it's a health condition. And I think it's important that people know that.
Sure. Yeah, really important. Before we wrap up, Niamh mentioned actually about Botox. We never really got into it. Like, do you have like a little kind of a soundbite on that? And
Oh,
when can we?
Botox. Bro, you know the way being a woman costs you a fortune in this world, the pink tax. We pay a hell of a lot for like more for razors. Obviously, we have to buy all our sanitary wear. You know, we buy makeup. We get our hair dyed. We have much more pressure on us. It costs a lot more money for me to be me than for a man to be him. This is where women get our own back. When they come for their Botox, their foreheads tend to be bigger, their muscles tend to be stronger. We got to pack more units in there. So that's why man's Botox costs more money, because they
interesting
just
to
need a
know.
hell of a lot more in there in general. Because you know, especially an expressive Irish man, yeah. So like the standard prescription dose is 20 units. That's what Allergan have been, you know, approved for, I suppose, and the FDA have approved for it, you know, for back in the day when it was first approved for aesthetic purposes, 20 units in the forehead. And obviously you wouldn't do that for everyone. Their eyebrows would be down by their chin. In other people, it wouldn't knock a feather off it. And in men, it's not unusual sometimes to have 40, 50 units in a forehead. So that's why it costs more money. They're certainly shyer. It's usually what happens is the wife comes in and then she had a good experience. And then the husband says, geez, I wish I could have a go at that. It's like, well, why don't you go? And they're terrified. But I think I actually, compared to most aesthetic doctors, and I know it's only a new clinic, so it's very difficult to say, I have a lot of men on my books in comparison. It's normally
From sports.
Yeah, you see, it's 99% women, 1% men for most clinics. For me at the moment, it's 90% women, 10% men. So I have now
That's very
more.
That's interesting. Yeah,
But that's because I do sports performance and my background is sports psychology and I do sport and I'm doing the hair as well. I think men know they can come in. Look, who knows? For all I know, if they bump into their mate when they're leaving the clinic here, they think, "Oh yeah, I got a steroid in my knee, mate." Whereas
Yeah.
really,
they can sort of pass it off. They mightn't be saying that they're having a cosmetic treatment, but
yeah,
they feel comfortable enough anyway to come to you, which is great. Because I mean,
yeah,
it should be equal opportunities, but it's
absolutely.
expensive for them because they need more toxin.
The first go and the second go is way more expensive for them. And then if they get their Botox regularly, you will find in general their forehead, I don't know what it is. It keeps its shape a bit longer than it does for probably because they don't give out as much as we do and they're not
They
expressive.
don't worry as much as us.
Yeah, exactly. So after a while, you will definitely see the amount of units they need decrease, especially if they look after their skin. And I realize with these men as well, you have to make it very simple. Like you literally just write it out, use this cream, buy this cream, and they're happy with that. Now, more than likely, they go home, they tell herself indoors, look, doctor told you to buy me these. But, those who do that,
But I find
You're
actually,
pleased.
I do find certainly with the men in my life, once a doctor tells them to do something, they generally tend to do it. Whereas
it's to get them to the
personally,
doctor though.
I'm the worst at doing like the physio exercises that I'm given, or I'm the worst at, following instruction. I'm like, oh, I'll do that tomorrow when I'll do it in time. But I do find that the men I know, if they're told to do something, they will tend to do it. No, it might take
Send some of those men my way.
I was a very biddable men in my life. But I think it's great that men can seek this kind of stuff now as well. That it's opening up and hopefully it will destigmatize it as well.
Yeah, and also like, men have their skin issues as well. Like we're talking about acne and all this, men suffer from these things as well. And there's no reason to suffer without getting help. Like it's funny, I have a phone number now for the clinic and that obviously it took me like, that's a whole other podcast the trouble I had with air, but but eventually I have a phone line. And now since I have the phone line, the inquiries from men have definitely picked up. Or like, do you treat men is often the first question. I'm like, of course I do. You've got a beating heart.
So
I don't care if you're a
interesting.
purple alien from outer space. I'm treating you. Do you know?
Ah, that's so interesting. This is just on a real tangent. Just another vignette that has come into my head. I had a man once came into me for a GP, and he had hyperhidrosis in his axilla, so excess sweating from the armpits. He really didn't like it. So I referred him to the general surgeon who I know used to do this. And I was his intern years ago. So they used to do that in the clinic all the time. I was like, yeah, I used to see him doing Botox for the armpits all the time for excess sweating. I'll refer you to him because he'll take care of you. So turned out this guy had stopped doing it and he was not doing Botox anymore for the armpits, just took it off what he was offering. So the patient came back and he wanted other options. So I was like, you know what? This is the girl that does my Botox. I know she does this procedure as well. Give her a call. And he just absolutely he would not go to an aesthetic clinic. I gave him a few options of a few aesthetic clinics. It was going to be the quickest possible way because to get this done in a general hospital was proving to be tricky because the service was no longer there. And he is absolutely point blank would not go, which I thought was interesting. I thought it was I mean, I'm trying to think of a different. If I was asked to go to like a soccer club to get some, I could go if I needed to do it.
Jesus, the state of the League of Ireland grounds around this country, please nobody get anything injected anywhere there. God knows it'd end up with what kind of disease. They're filthy.
I thought it was interesting. It was just a hard no. He wasn't going to do it.
Yeah.
Yeah.
Well, hopefully that will change because I mean it has so many. Botox certainly has so many more uses, and I think the last thing I'll say about Botox is people do forget that it comes from botulinum toxin, which is the disease is botulism, which is lethal unless treated. People are always surprised when they hear that it comes from Clostridium, whatever it is, botulinum, but it is something that we have extracted from a lethal pathogen. And it's a serious medication and it has multiple clinical uses. And we should respect it because of that.
My
I don't
mom
know
eats
if it's an
temple, but give me the toxin.
exactly. Yeah, I'm a vegan, but you know, give me the toxin. Like, I don't know if it's an urban legend. I don't know if you have urban legends in Ireland, but allegedly, you know, the way Allergan, the big factory in Westport, makes Botox for the whole world. Allegedly, this plane comes in every year into like people's. This is where I think it could be untrue because allegedly the plane goes into Shannon Airport. Like, and why wouldn't it fly into Knock and Mayo? But that as it may. Allegedly, this plane flies in from America with a teeny tiny little dose of pure botulinum toxin for the year. And that's brought up to Allergan. And then that teeny tiny little powerful vial that apparently if you open it would kill you instantly, like a la Superman and Kryptonite. And then apparently that little teeny tiny bit gives the Botox to everyone around the world. I don't know if that's true or not, but I think that's a great story. And I think that's a great point to finish off this podcast. We'd rattle on for hours, but like nobody has time for that, despite how entertaining we think the three of us are. And we're going to do a few more of these podcasts as well. So please let us know if you enjoy them. You know, like, share, tell everyone to listen, tell us what you like, tell us nicely what you don't like. Thank you very much for joining us. We hope that you'll join us again sometime. And we've had great crack with this. And hopefully you guys have found it a little bit fun and a little bit informative. Slán go fóill. We hope you enjoyed this episode and please continue to be part of the conversation with us. Please subscribe to our podcast, No Scrubs.